A consultant who worked at the South West Acute Hospital told colleagues that surgery at the hospital was simply dying. He worked at the hospital for 7 months, and in an email seen by the BBC, he said during that time he did not have any access to the main operating theatre. A month ago, emergency general surgery in Enniskillen was temporarily suspended. Earlier we heard from the Western Trust's chief executive, Neil Gukian.
The Minister issued new standards for emergency general surgery in June 2022, and we are struggling to adhere to those standards. I would accept that, but we've done all we can to sustain emergency general surgery in the South West Acute Hospital.
Well, let's talk to Helen Hamill from the campaign group Save Our Acute Services at the South West Acute Hospital. You're very welcome to Evening Extra, Helen.
Thanks a lot. Thanks a million.
Just wondering, what was your reaction when you heard this from the consultant today from the South West Acute Hospital saying that they didn't even get into a main operating theatre for 7 months?
I have to own up to the fact that we saw that email. We have had stories, a lot of which are really confidential and are actually really frightening. The knock-on effects of what's happening in our hospital are constantly evolving. People are reporting more and more to us about emergency provision and the difficulties that they're facing. And it's a very stark reality. It's an unhappy stage to walk through our hospital. And I did today. I was at an outpatient clinic with my dad. I spoke to nurses. I can see people are crestfallen. It's like a beaten down football team. And, you know, for Mr. Gucky, I might just after hearing Neil speaking there, and to be honest, you know, what Neil says is, I think he used the phrase there, I've done all we can. I would absolutely argue that point. I think they've done an awful lot of spin, if that's what they're calling it, put it that way. I think there's a lack of ambition and a lack of understanding how to attract, number one, by actually advertising the jobs at South West Acute. Fermanagh is a lovely place.
Well, Helen, Neil has said in terms of recruiting consultants, you know, there is a stringent process with really strict criteria that they have to adhere to, and that the applicants were not meeting that criteria. And he also said that there have been no clinical issues due to the transfer of emergency surgery.
That's absolutely not what is published in our local media, and that is not the stories that are coming forward.
Well, that's
and
what he
some
said.
of them, I understand that, and I said we're going to have to agree to differ until a further stage in this process. We had a mum who drove a child from South West Acute A&E department during what Neil is describing as the perfect situation. We had a mum who had to drive a child who was identified as needing emergency surgery and needing his appendix out, being told, no, you cannot move him, he needs to be transferred by ambulance to Altnagelvin. And when NIAS were overstretched, and again, NIAS, we have the poorest access to NIAS down here. I mean, rural is a different rural when you come south of the ban, and everybody knows that. But a mum had to put her child in a car, drive him to Altnagelvin. Now, the risks involved in that, you know, the increase in morbidity and mortality for every parent who gets a phone call from an ED department to say, could you please drive your child up the road? And
Helen, we brought earlier the response from the Trust on that particular story. I think it was reported in the Fermanagh Herald. And, you know, there are anecdotes across Northern Ireland at the minute of people really finding pressures within their local health services. But what we have been hearing about today is how the SWAH, you know, there's plans for it to be bringing in planned surgery now for gallbladder. There's going to be to help cut waiting lists across Northern Ireland. And we are increasingly hearing from the Trust how they are hoping to use the SWAH in a way that's more efficient for the health service on a whole. I mean, would you be accepting of that even, Helen, that this could help waiting lists?
Well, yes, it will help waiting lists, but you have to realise there's two separate strands here. What Neil Gucky is building an elective hub out of is an emergency temporary collapse of workforce. And I mean, the fact that, you know, we're human rights, our equity, Fermanagh lives are worth the same as I don't know, Bangor lives. But the reality is that without an ED department that is staffed by surgeons and is accessible as a Type 1 acute unit, we add every Fermanagh person in an ambulance even adds an extra at least 60 minutes to their journey. Now, you know, a man with an arm cut off in Balcas 2 hours up the road. A man waiting on an ambulance having a stroke, another hour up the road. You know,
and there are these. You know, we've heard these stories. These unfortunate stories people have been telling us on BBC Radio Ulster. And the workforce challenges have been well documented across BBC News.
But can I just say the bit that's not well documented, and I'm going to have to pin it down. We have an exceptional case here. We're a border area. We are deprived or acknowledged as an area of deprivation. We have a poor infrastructure. The Trust there's a lack of ambition in the recruitment. There's no attempt to attract consultants and retain them. And I think there was also regional rotas employed in 2020. That should be an interim measure, but there's 5 state-of-the-art theatres in South West Acute. There is the capacity to build in specialisms, to attract surgeons, as we have before, from across Europe. Like the doctor whose story you read there a minute ago. You know, we can attract, we just aren't retaining. And I think when you start doing that, if you're a football management, if your team is not able to pull players out, I think you look a bit closer to the management than the problem. And I think bariatric surgery was mentioned here as a long-term vision and a viable vision for South West Acute. There's equipment in that hospital to facilitate that.
And we know,
the vision is the retention of staff. But I mean, it's Northern Ireland's waiting lists. Are they worth more than Fermanagh Lives?
Helen, I hate to push on this. I know we're just up against it for time. And as we did reflect earlier on in the programme, there are plans to use those surgery facilities. Things like we heard from Julian Fowler, our reporter earlier, particularly gallbladder going to be penciled in for people who've been waiting for 4 years on waiting lists to have their surgery down at the SWAH. We'll be talking about the plans to transform healthcare in Northern Ireland with Deirdre Keenan, an expert in this area, between now and 6 o'clock. But thank you for joining us, Helen Hamill from the campaign group Save Our Acute Services at the South West Acute Hospital.